anterior tibialis attaches at the anterior tibia, at the lateral condyle of the tibia, and the proximal 2/3 of the tibia on the anterior surface, and also the proximal 2/3 of the interosseous membrane. The interosseous membrane being the thick, dense connective tissue that connects. Hey everyone, thanks for tuning in. Steven here with Team Forward, and this week's YouTube shorts are dedicated to the anterior tibialis muscle. The anterior tibialis is one of your postural muscles, and it's one of two stirrup muscles, and one of its responsibilities is going to be stabilization and support of the medial arch of the foot, which makes it a very important muscle, especially in managing something like foot and ankle pain. It's often going to be very, very weak in a lot of people, which means you would want to perform some strengthening exercises for it. For the anterior tibialis, there are only three bones that we need to be covering, and that is going to be the tibia, the medial cuneiform, and the first metatarsal. With regard to the tibia, that is going to be your shin bone, and it's going to be the most medial. It's the thickest bone in the lower leg. Right over here, we have the anterior surface on the front, and then we have the medial condyle of the tibia on the inside, and then on the outside, we have the lateral condyle. Then, if we were to travel just a little bit inferior to that, we have the anterior surface of the tibia, and then that's it in terms of the tibia. Then, if we go down to the foot, right over here is the medial cuneiform, or the first cuneiform, and then just distal to that we have the first metatarsal. But those are the only important bony landmarks when discussing the anterior tibialis. The anterior tibialis attaches at the anterior tibia, at the lateral condyle of the tibia, and the proximal 2/3 of the tibia on the anterior surface, and also the proximal 2/3 of the interosseous membrane. The interosseous membrane being the thick, dense connective tissue that connects the tibia and fibula together, and then it inserts into the medial cuneiform, or the first cuneiform, and also the first metatarsal. And because it crosses the ankle, we know it has an action at the ankle. At the ankle, its main action is going to be dorsiflexion, or pointing the toes up toward the head, and as a secondary action, it's also going to be responsible for inversion, or bringing the sole of the foot in toward the midline. But those are the only actions for the anterior tibialis. The anterior tibialis is innervated by the deep fibular nerve, and more specifically your L4 and L5 nerve roots. And the reason that's going to be very important is because if we have any type of damage or compression to the nerve roots in those areas, then the nerves are not going to be able to send the proper signal to the anterior tibialis to fire properly, and that can limit blood flow and oxygen to the area, which can lead to things like foot and ankle pain and also postural dysfunction. So what we can do to address that would be to do some ELDOA exercises for the nerves in those areas. The reason the ELDOAs are going to be so great is because the whole purpose of an ELDOA is to create space within a joint. So if we create space, we can improve the function of the nerves, and then the nerves are going to be able to send the proper signal to the anterior tibialis to fire properly, and that can improve the blood flow and oxygen in that area, which can mitigate things like foot and ankle pain and also postural dysfunction. For the strengthening exercise, we're going to be in a seated position, and we want to start by flexing our knees to 90 degrees. And the principle of action, what we want to do is go into as much dorsiflexion as possible by bringing the toes up toward the head. And this is the strengthening exercise for the anterior tibialis. And then if we want to load it and progress it, what we can do is, if you have a partner, you can have a partner apply a pressure and use them as resistance. And if you have some equipment, what you can do is either tie a resistance band, a cable, or also some weights on the heels, and then that way we can load the exercise. But that is the strengthening exercise for the anterior tibialis. For the stretch, I'm going to be taking you through 4 different progressions. This first one right over here, what we want to do is get into a half kneeling position, so as though you're in the bottom position of a lunge. And then the principle of action, we want to get into as much plantar flexion and eversion as possible. We're going to do that by going ahead and sitting down onto our calves. You can use your hands for support. Then, if this is easy, we can progress it by straightening out the legs, so we have a little bit more weight on the back leg. If this is still too easy, we can elevate the leg. And lastly, if this is still too easy, what we can do is go ahead and get into a tall kneeling position, and do this bilaterally by sitting down onto the ankles. But those were the 4 progressions for the myofascial stretching exercises for the anterior tibialis muscle. For the L4, L5 ELDOA, we're going to be in a seated position, and we want our heels at the level of the ischial tuberosities. If you don't know where that is, make a fist. Roughly the width of one fist width is going to be the level of your ischial tuberosities. And from here, we want to flex the knees to 90 degrees. We're going to go into dorsiflexion of ankle by pointing the toes toward our head, eversion of ankles by pointing the soles of our feet away from each other, and then we want to drive our knees down toward the ground. At the pelvis, retroversion of pelvis, flat lumbar, flat thoracic, our chin is tucked in, crown of the head is up, eyes are looking down between our thighs to put the dura mater under tension. With the arms, maximum extension of elbow and wrist, maximum external rotation of shoulders, flex shoulders to the level of coronal plane, so bicep in line with the ear. We're going up with the palms, up with the crown of the head, pushing down with the knees, and this is the L4, L5 ELDOA.